So we look at another complication of this one is a complication of the liver, right? Hepatocytes, cells of the liver. Right, so tender means something is, if you touch it, the person feels so much discomfort by you touching it. Megaly is something that is big. Okay, tender hepatomegaly in children. So let's quickly look at it. Of course, if the liver is big, is indicating that there is an underlying issue. All right, so let's look at it. If you see this in children, it simply means there's an enlarged liver that is very painful, is sensitive to touch. You want to touch it, there's a whole lot of discomfort. So the clinical findings often signals that there's an issue underneath. All right, there's congestion, there's infiltration of the liver. Then of course you have to actually attend to such a child, So if we're not just trying to put this tender hepatomegaly, like if you see it, what are the things you should be suspecting? All right, so if you see tender hepatomegaly, you can be suspecting infections like viral hepatitis, Epstein-Barr virus infections, cytomegalovirus infections, malaria infections, leptospirosis or typhoid fever. You can also be suspecting cardiac issues like congestive heart failure, constrictive pericarditis, or the Budd-Chiari Syndrome. Okay, hepatomegaly, an enlarged liver. So under the metabolic and genetic issues, you can be suspecting glycogen storage disease, you can be suspecting Wilson's disease, you can be suspecting alpha-1 antitrypsin deficiency. Okay, under the blood issues, you can be suspecting hemolytic anemia, you can be suspecting leukemia, you can be suspecting lymphoma. So other issues you can be suspecting could be that you are suspecting that the body's immune system is kind of like fighting the body cells. That's autoimmune issues. All right, then drug-induced liver injury, okay, liver abscess or tumors. So clinical clues like if you see a child with tender hepatomegaly, you should also check out for other things. So check out if the child has fever. You cannot be directing you towards infection. Check out if the child has jaundice. You cannot be directing you towards red blood cell breakdown is too much, hemolytic anemia. All right, check out if the child is weak. Check out if the child has abdominal distension. Of course, to be showing you that maybe there's a swelling issue, poor appetite or weight loss. So check out also if the child has poor appetite or weight loss. So diagnostic approach is physical examination. You want to actually assess the liver size. Blood test, you want to check out for the liver function. Imaging, you want to check out for ultrasound or CT scans. Then further tests depending on what you are suspecting. Okay, so management is if it is infections, if it is viral infection, antiviral drugs, malaria, anti-malaria drugs, bacterial infection, antibiotics. Okay, heart failure uses diuretics and all of that. Metabolic issues use dietary management. Malignancies now opting for chemotherapies and also surgical resections.